Thank you. Annette Rodriguez, Public Health Director. I'm going to start with the COVID-19 statistics. First slide, please. There it is. So this basically shows the daily COVID-19 cases here in Nueces County. So you can clearly see that on the far right side, the numbers were in the 50s and then kind of wobbled 80, 50, down to 7 in one day, and then 60, 70, 170, 200, 217. And so the numbers are still high today at 148 COVID-19 cases in Nueces County. So does that indicate a second wave? No, but all of these numbers combined do indicate that we're on the verge of a second wave. Next slide, please. So this diagram basically shows that there's a total of 23,536 total cases in Nueces County, which 21,381 have recovered, but there's also been 472 people that have lost their lives to COVID-19 here, and leaves a number 1,683 active cases in Nueces County currently. These individuals all should be in isolation, and they have people that have been exposed to them that should be in quarantine. Next slide. These are the hospitalizations as of today. 132 are in the hospital with COVID-19. You can see on the far right-hand side, we were at 86. If you look 2 weeks prior to that, we were in our 50s for hospitalizations, and we were trying to get below that before this second wave started coming. And so we started at a baseline of 50, and we're already at 132 hospitalizations in just one day for COVID-19 patients. Next slide. These are people that are in the intensive care unit here in Nueces County, and so total for today, 39, which is down from yesterday. We had 47, but we know that not all people recover. You know, we had 2 people that lost their lives to COVID-19 today, and our hearts go out to those families of those 2 individuals. Next slide. So bringing the total death rate for Nueces County up to 472 with the 2 that I just mentioned today. So, and the last slide is basically showing you the first wave, which we all know was around July 14th when we peaked at 605 cases. And so now you see the red line, you see the bar graphs over here, the numbers are going up, so you know that we're in our second wave of cases. The 7-day average is 169 daily cases every day for the last 7-day average, which is really unbelievably high from where we were a few weeks ago. So I'm going to talk a little bit about what's going on at the health district. So we do continue to hold our drive-through COVID-19 testing, and our next drive-through will be this coming Saturday at 8:30 in the morning at the health district. You can self-register for the drive-through at cctexas.com/coronavirus and click on the drive-through link. The latest information on the COVID-19 vaccine indicates that the first distribution of COVID-19 vaccine may begin arriving by mid-December. That's a few weeks from now. While there may only be a few doses of vaccine earmarked for the healthcare workers initially, it is the beginning of doses arriving in our community and something that is really needed. A vaccine, along with therapeutics, which we started receiving last week in small doses, will be the most effective way of ending this pandemic. The COVID-19 virus will become another virus, like the seasonal flu virus, that we most likely will just have to learn to live with. The health district is preparing for this mass distribution of the COVID-19 vaccine and microplanning currently. Microplanning is planning the minute details of how the vaccine will be distributed efficiently and safely. However, while we wait for the vaccine, it is imperative that everyone continues to actively practice the public health measures that the judge mentioned, the 3 W's, and we're all familiar with. We have all seen in July how quickly the virus can spread, causing high number of hospitalizations and deaths. As Thanksgiving approaches, we are already experiencing steady increases in our daily COVID-19 cases. These increases are very disconcerting for public health as well as our medical community. It indicates that any additional cases added to our already rising numbers will cause additional strain on our healthcare system. We are asking that all residents be diligent about using all precautionary measures available. While we realize that this is an unprecedented pandemic, and we understand that this is no one's fault that we're in the predicament that we're in currently, we also understand that personal choices and personal behavior will make a difference on what happens to our numbers here in Nueces County. Here's what we know about the vaccine that we will be receiving. There are now 3 vaccine candidates that look promising for getting some protection against COVID-19 to our communities soon. They are Pfizer, which has already submitted an EUA, Emergency Use Authorization, to the FDA. The FDA is scheduled to meet December 10th, and we believe that they will give their approval at that time. Quickly after, within 4 or 5 days, they will start sending us vaccine so we can start administering it to the named priority groups. The other 2 vaccine candidates that are following closely behind Pfizer are Moderna and AstraZeneca. You may remember AstraZeneca was on pause, but now they are rolling full steam ahead, and they look like they may have a vaccine here very soon that's ready to be distributed. All 3 of these companies have COVID-19 vaccine that require 2 doses. One is 21 days apart, and the other 2 are 28 days apart, depending on which vaccine you receive. The 2 doses have to be received from the same vaccine candidate. So if you receive your first dose from Pfizer, you must get your second dose from Pfizer. The same is true for Moderna and AstraZeneca. You cannot mix doses between 2 different vaccine companies. Pfizer has demonstrated and observed efficacy of their vaccine to be 95% effective, and in adults 65 years and older, they have a 94% effectiveness, which is truly amazing. They also have not seen any serious side effects, but have noted some people have experienced headaches or fatigue. So here is the updated information as of today on who will be prioritized to receive Phase 1A, first tier. This is the group. Number 1, hospital staff working directly with patients who are positive or at high risk for COVID-19. This includes physicians, nurses, respiratory therapists, and other support staff, including custodial staff working in those areas. Also, additional clinical staff providing supportive laboratory, pharmacy, diagnostic, and/or rehabilitation services. Number 2, they're also in the Phase 1A first tier to receive the vaccine. Long-term care staff working directly with vulnerable residents. Who does this include? Direct care providers at nursing homes. So who are the individuals that are actually leaving the nursing homes? It's only the workers. So the workers would actually get the vaccine. Assisted living facilities and state-supported living centers. Also physicians, nurses, personal care assistants, custodial, food service staff. Number 3, EMS providers who engage in 911 emergency services like pre-hospital care and transport of patients. Number 4, home health care workers, including hospice care, who directly interface with vulnerable and high-risk patients. That's Phase 1, first tier. Then, as more vaccine arrives, there will be Phase 1A, second tier. This group includes, next slide. This group includes the staff in the outpatient care offices who interact with symptomatic patients, which includes physicians, nurses, respiratory therapists, and other support staff, custodial staff working in those areas as well. Clinical staff providing diagnostic, laboratory, and/or rehabilitation services. Also, non-911 transportation for routine care. Number 2, direct care staff in freestanding emergency medical centers and urgent care clinics. Number 3, community pharmacy staff who may provide direct services to clients, including vaccination or testing for individuals who have COVID-19. Number 4, public health and emergency response staff directly involved in administration of COVID-19 testing and vaccination. And number 5, the last responders who provide mortuary or death services to descendants with COVID-19, which includes embalmers and funeral home workers who have direct contact, also medical examiners and other medical certified individuals who have direct contact with the descendants. And number 6, nurses that work in the schools around COVID-19 positive faculty and students. So those are the priority groups currently listed. Everybody's been asking us who are the priority groups. Those are the first group of priority. They have not given us the priority groups for the other categories at this time. So I'm going to change gears for just a few minutes to Thanksgiving. The Health District wants to recommend, as we have been, that if you celebrate this Thanksgiving, that you celebrate only with those individuals who live in your household. However, if you choose to host a gathering, keep it outdoors. Keep it small with only household members and extended family members, and keep those masks on. Make certain everyone wears a mask properly. That means covering their nose and mouth. Washes their hands often, practices social distance, and eats at separate tables with people from their own household. Everyone will be taking off their masks to eat, so make sure you keep them separate. When you finished eating, everyone should put their masks back on for the entire time that they are gathered. If your gathering is indoors, everyone wears the mask the entire time, and open up your windows in your home to keep the air circulating and discourage behaviors such as hugging and singing and playing games that involve sharing one cell phone and passing it around, and even handshaking. If every single person does their part this holiday season, we may be able to keep our numbers where they are now or even lower them. Despite having to endure a pandemic like we've never seen before, one that has caused a lot of pain and suffering, we still have a lot to be thankful for. We in public health are thankful for each of you in our community that wears masks and does what is being asked in an effort to keep each other safe. Stay safe, stay alert to your surroundings, and as always, stay informed on what our cases are doing locally and also around the world. May you have a happy and blessed Thanksgiving. Thank you.